My name is Samantha Holmgren. I am a registered dietitian and I have psoriatic arthritis. With my clients, in the work that I do, and in my personal life, I focus on moving towards balance and wellness while living with chronic pain and fatigue. At the heart of my work is a focus on mindfulness and making small changes that have outsized impacts, the bare minimum health plan. The trick is using nutrition knowledge and grounding it in your connection with your body. This is how you can unlock balance and wellness as you chart the best path to wellness for you. On that note, here are the 5 anti-inflammatory food choices that can help you better manage your health. Number 1, omega-3s. You're probably not surprised to see this on the list. It's one of the most popular and probably one of the original anti-inflammatory recommendations and supplements. Because it's been around so long, we have a lot of research to back it up. For example, in people with rheumatoid arthritis, it's actually been shown to have clinical impacts, reducing tender joint count and swollen joint counts, and even reducing the amount of pain medication people need to take. Number 2, olive oil. Olive oil is just as powerful and anti-inflammatory as omega-3s. By increasing both and decreasing some of the more processed and pro-inflammatory types of fat, you can have an even bigger impact than increasing one of them alone. Plus, it's good for your gut. There are compounds in olive oil that the good bacteria in our intestines really love. It's a prebiotic. Number 3, turmeric or curcumin, which is the effective compound in turmeric that has been studied. I would love to see some more large scale studies, particularly looking at like the clinical outcomes that I mentioned with regards to omega-3s. But the research is very promising. In a recent deep dive I did on the research, I was pleasantly surprised at just how promising it looks. But until we have those larger scale studies looking at clinical outcomes, we can't give the same confidence that supplementing with curcumin is definitely going to help. But if you like turmeric, definitely throw it in your food. And the risks of supplementing are relatively low, so it may be worth experimenting with, especially if you have an inflammatory health condition. Number 4, magnesium. Inflammation isn't just about the foods you eat and their direct impacts on inflammation. Your sleep plays a role, stress levels, and just overall adequate nutrition is important. Magnesium can be beneficial for those who get nighttime leg cramps, and I've seen with clients in the past who have restless legs that it can also improve your sleep. So if either of those are issues for you, you can try adding a quarter cup of pumpkin seeds, which contains 300 milligrams of magnesium, almost your entire day's needs, or you can try a small supplement. Last on the list isn't a nutrient, but a pattern of eating, the Mediterranean diet. It combines a lot of the individual pieces of advice in terms of eating fish, having fruits and vegetables, the whole grains, nuts, seeds, and beans, reducing red meat, reducing processed foods. All of these individual components are brought together under the Mediterranean diet. We don't just eat nutrients. We don't go out there and eat a bowl full of vitamin K. We eat food, and we eat food in combination with other foods. And that combination of the nutrients within a food and different foods together has different effects. The overall pattern of eating is what's really important here. And the Mediterranean diet is one of the most studied diets out there and has been shown to have benefits for cholesterol, blood pressure, arthritis, and so much more. So, this is a great place to aim for when you're making adjustments to your eating. If you'd like more insight on how to put all of this into action, on the other components of a healthy diet, of the ways that your mindset influences it, be sure to check out the Bare Minimum Health Plan. Link is down below.